Oral incretin-based therapy, 2025 paradigm shift. Dr. Ashutosh Mishra from Panacea Hospital, Varanasi. Good morning. For 2 decades, we battled diabetes the wrong way, chasing blood sugar targets, celebrating HbA1c 6.5 or 7%. But patients still die young: heart attacks, kidney failure, strokes. Why? Because diabetes isn't just sugar. It's a cardio-renal-metabolic disease, and our approach must shift from sugar chasers to heart-kidney heroes. That's the 2025 paradigm shift. The SOUL trial, published March 2025 in NEJM, tracked 9,650 type 2 diabetics with heart or kidney disease for 4 years. Results: 14% fewer major cardiovascular events. Heart attacks down 26%, heart failure hospitalizations down 17%. The kicker: one simple oral pill, no injections. This is not just glucose control, it protects heart, kidneys, and metabolism. Here's the science. 75 years ago, we learned oral glucose triggers more insulin than 4. The gut hormones GLP-1 and GIP drive 50 to 70% of mealtime insulin. GLP-1 smartly boosts insulin without hypoglycemia, calms glucagon, slows digestion for fullness, and works on heart and kidney receptors too. Gut hormones, not the pancreas, are the real bosses. In type 2 diabetes, the enzyme DPP-4 quickly destroys GLP-1 within 2 minutes, rendering 90% of our gut's magic useless. GIP fades in 7 minutes. This broken gut signal is why traditional incretin effects fail. Introducing oral semaglutide, a 31 amino acid molecule that's normally destroyed by stomach acid. Novo's breakthrough SNAC technology protects it through the gut wall, giving 0.4 to 1% absorption, enough for therapy. Pioneer trials prove it cuts HbA1c by 1.4%, helps shed 4.4 kilograms, matching injectable semaglutide. The catch: take it 30 minutes before meals on an empty stomach. Beyond glucose and weight lies SOUL's impact: 14% fewer major CV events in high-risk patients, 26% fewer heart attacks, 17% fewer heart failure hospitalizations, and 22% less kidney albuminuria. This is a cardio-renal-metabolic therapy, not just a sugar pill. In India, December 2024 brought Trelagliptin, a weekly DPP-4 inhibitor from Zuventus. Though not cardioprotective like GLP-1 RAS, its weekly dosing boosts adherence dramatically from 30 pills a month down to just 4. Perfect for elders, caregivers, rural patients, and budgets. At 500 to 800 Indian rupees per month, it's a game changer for many. Daily DPP-4 inhibitors lower HbA1c modestly with low side effects but offer no heart or kidney protection. Their role is now narrow: frail elders, advanced kidney disease, or GLP-1 intolerance. Cardiovascular frontline winners are GLP-1 receptor agonists. Meet Lilly's Orforglipron small molecule GLP-1RA, oral once daily with breakfast, no fasting needed. Phase 3 trials show HbA1c drops of 1.4 to 1.5%, weight loss up to 9 kilograms, and impressive remission potential. FDA filing in 2025, India by 2027 to 28, and 30 to 40% cheaper than semaglutide. This could be the real oral incretin revolution. India houses 10 million type 2 diabetics with CKD, mostly on outdated drugs with no kidney protection. SOUL confirms semaglutide safe and effective across eGFR 15 to 90. It slows kidney decline, reduces albuminuria, and cuts inflammation. The triple therapy of GLP-1RA, SGLT2I, and ACEARB is our best defense against dialysis. GLP-1 works in the brain, suppressing appetite and boosting fullness signals from the gut. Weight loss of 15 to 25% is common. Early nausea affects 40 to 50% but fades in 6 weeks with slow dose titration. Patients often say, 10 days of nausea, then great results. Tailor treatments: CV or kidney disease. Oral semaglutide for cardio-renal shield. Overweight without CV risk. Orforglipron for weight and glucose. Elderly with polypharmacy. Weekly Trelagliptin for simplicity. Severe CKD or cost barriers. Linagliptin or future affordable options. Individualized care, patient by patient. Current semaglutide costs 8 to 12,000 Indian rupees per month, out of reach for many. Patents last to 2032, but generics and new small molecule treatments promise affordable access by 2030. Trelagliptin serves as a vital bridge now. Tirzepatide combines GLP-1 and GIP actions for deeper HbA1c and weight drops. Oral dual agonists are coming by 2027 to 28, promising next-level diabetes therapy. Diabetes is a cardio-renal-metabolic disease, not just sugar. Oral semaglutide cuts CV events by 14%, first oral therapy with this power. Trelagliptin offers weekly simplicity for many Indian patients. Orforglipron arriving soon, better efficacy, no fasting needed, and cheaper. Costs will drop by 2030, expanding access and saving millions. Prescribe semaglutide for ASCVD-CKD patients now. Use Trelagliptin for slow adopters and elders. Prepare for Orforglipron's launch. Push insurers and policymakers for coverage. Stay updated. The 2026 wave of data and drugs will reshape care. Thank you. The golden hour for diabetes care is here. Beyond glucose, saving hearts and kidneys. Prescribe protection, not just pills. Jai Hind, Jai Bharat.